Let's tackle a classic and critical guideline topic for the FRCEM final SBA, managing febrile infants under 3 months using the NICE traffic light system. Here's the scenario. A 2-month-old girl presents with a temperature of 38.1 degrees Celsius. She's feeding normally, alert, and only has mild nasal congestion for 24 hours. No cough, vomiting, or diarrhea. She had her 8-week immunizations just yesterday. On exam, her heart rate is 160, respiratory rate 50, capillary refill under 2 seconds, mucous membranes moist, and no focal infection signs. Perfusion and hydration look good. The question, according to NICE NG 143, what's the most appropriate next step? A. Discharge home with safety netting advice. B. Admit for a full septic screen and start empirical IV antibiotics. C. Perform a urine dipstick and send a urine culture before deciding on admission. D. Observe in the ED for 4 hours, repeat observations, then discharge if stable. E. Prescribe oral amoxicillin and review in 24 hours in pediatric clinic. Take a moment to consider your answer. The correct choice is B. Admit for a full septic screen and start empirical intravenous antibiotics. Why? Infants under 3 months with a fever of 38 degrees or higher automatically fall into the red category on the NICE traffic light system, regardless of how well they appear or how well they're feeding. This red flag means they're at high risk for serious bacterial infections like meningitis, septicemia, or urinary tract infections. Guidelines mandate hospital admission for a full septic screen, blood tests, blood cultures, lumbar puncture, urine culture, and chest x-ray if respiratory signs are present, plus prompt empirical IV antibiotics, typically amoxicillin with gentamicin or cefotaxime depending on local protocols. Recent immunizations can cause mild fever, but don't change this management pathway in young infants. Why not the others? Option A, discharging home, is too risky given the high chance of serious infection in this age. Dipstick alone is insufficient. A full septic screen is needed immediately. Option D, observing in the ED for several hours before discharge, delays definitive treatment and increases risk. Option E, oral antibiotics and outpatient review don't provide adequate coverage for invasive infections in neonates. Key takeaway, any infant under 3 months with a fever of 38 degrees or above must be admitted for a full septic screen and started on intravenous antibiotics, even if they look well. The NICE traffic light system is your guide to identifying these high-risk patients in the emergency setting. It is almost certain to come up in your exam. For more practice like this, with 40,000 questions and 20 mock exams covering every emergency medicine topic, visit emfinalexams.com.